Audio Jungle.
Developing severe migraines in middle age is a major warning sign of stroke risk. Experts have warned. Over 50s who start suffering aura migraines, a common type involving distorted vision and flashing lights, have double the risk of suffering a stroke in the next 20 years, a study concluded. Those who suffer migraines from a younger age were at no increased risk, the researchers found. Experts led by the University of South Carolina tracked 11,600 people for 2 decades. They found those who developed aura migraines after the age of 50 had an 8.3% chance of suffering a stroke, 2.17 times the risk of those who did not suffer migraines. Those who suffered migraines without aura had no increased risk, irrespective of the age of onset. Study leader Dr. Michelle Androlakis, chief of neurology at WJB Dorn VI Medical Center in South Carolina, said, "I think clinically this is very meaningful, as many individuals with a long history of migraine are concerned about their stroke risk, especially when they get older and when they have other cardiovascular disease risks." Cumulative effects of migraine alone with onset of migraine before age of 50 did not increase stroke risk in late life in this study cohort. On the contrary, the recent onset of migraine at or after age 50 is associated with increased stroke risk in late life. Her team, writing in the Headache Medical Journal, said, "To our knowledge, it is the first large prospective study evaluating the relationship between years of exposure to migraine and ischemic stroke." Around 8 million Britons, 3/4 of them women, suffer migraine attacks, which involve dizziness, nausea and crippling pain. Up to a third suffer aura migraines. Previous research has linked migraines to strokes, but few studies have so far detailed exactly which groups are at risk. Experts believe migraines occur for different reasons at different stages of life. They believe it may be that migraines which start in middle age are caused by the same underlying biological problems that cause all endovascular issues, those that affect the inside of the blood vessels. While the vast majority of people who have migraines will never suffer a stroke, doctors think that it should start to be treated as a red flag, especially if the headaches are regular and severe. Experts in the past have called for people who suffer the most severe migraines automatically to be given cholesterol-reducing statins, simply as a precaution to reduce their heart risk. A stroke occurs when a blood clot blocks an artery or there is major bleed in the head, reducing blood flow to the brain. Roughly 57,000 people in England have a stroke each year, of whom 32,000 are killed. Of those who survive, 65% leave hospital with a disability. Some 25% of survivors have a second stroke within 5 years. Dr. David Kernick, a GP at the St. Thomas Health Centre in Exeter, wrote in the British Journal of General Practice in 2015 that anyone who suffers an aura migraine which involves flashing lights or confusing thoughts should be considered for statins. He said a pragmatic approach should be taken to calculating the risk of heart disease or stroke in these patients,